ReSPECT is being implemented across all health and care settings in Worcestershire from the 1st of July 2019. It arose out of a review nationally by patients and clinicians of the current process of DNA CPR. That improvements were required both in the decision making and documentation of CPR. The ReSPECT form will be replacing the current red DNA CPR form in place across Worcestershire. However, it's important to understand that the presence of a ReSPECT form does not necessarily mean that the patient is no longer for cardiopulmonary resuscitation. The ReSPECT form does not replace, but is complementary to a number of other initiatives around treatment limitation that you may well be aware of.
Advanced care planning is a term used to describe conversations between people, their families and carers about their future wishes and priorities for care. This is usually a detailed process and helps the patient to anticipate how their condition may affect them in the future. If we think about emergency care planning, this provides concise, relevant and rapidly accessible clinical recommendations for use in an emergency. ReSPECT can be complementary to a wider process of advanced care planning. We're really lucky in Worcestershire to have this project solely funded by Macmillan from money that was left from 3 Worcestershire residents in their wills to Macmillan.